morning checkpoint. We're still on the COVID-19. A big day for Kenya after it was announced that 2 more COVID-19 or coronavirus cases were confirmed, and the 2 had been in close contact with the patient 0, the first case that was confirmed in the country. A panel here of experts to just try and help us unpack some of the directives and measures put in by the government, as well as what do we expect, where do we go from here. Once again, real quick, on my immediate left is Dr. Andrew Mulwa. He's a chairperson Health CEC's caucus, as well as a Health CEC Makueni County, as well as Peterson Washira, chairperson Kenya Union of Clinical Officers in Country, team coordinator African Volunteers of Health Corps, as well as a team leader the Sierra Leone Medical Mission during the Ebola epidemic. And as well, we are joined by Dr. Miriam Sidibe, public health expert, hand washing expert, as well as London School of Hygiene and Tropical Medicine fellow. She's joining us live from her home, and of course still just putting in some of her expertise to help us understand globally how are we expected to behave as a country, as a continent, and as a globe in light of this pandemic. So there's been a number of questions coming in from this conversation from our social media. One of them was asking, so one, after you have been confirmed that you have coronavirus, it's a confirmed case, what happens next?
I think first we must appreciate this is a new disease. It's a viral disease, and like many viral upper respiratory and respiratory infections, there is no treatment, but support in terms of if it's fever, you manage the fever. If someone is coughing, if they have difficulty in breathing, if they have issues with oxygenation, you supportive management. And therefore, to me, I look at it at once you get the disease, the clinicians have been trained on the protocols of management of the disease, and that becomes rather like a routine management, that once you get a person who has difficulty in breathing, you need to give them oxygen, you need to if they are very sick, you need to put them under ventilation and all that. There have been issues of some drugs that have been tried, and I'm saying this is a new disease that have been tried in China and elsewhere where this disease has been prevalent, and and there are those protocols that the healthcare workers, the frontline healthcare workers, who have been trained and they already know. Okay. Then there is the issue of the whole protocol of now, once you confirm the test, you need to continue testing so that you confirm that this person is negative by the time you discharge them. They are not shedding any more virus by the time you discharge them from hospital.
Peterson, I'd like us to quickly talk about preparedness in the country. We're talking about facilities, training for healthcare workers, not just in Mbagathi and Kenyatta and here in Nairobi, but extensively throughout the whole country and the counties. So there is a concern. If a case has been confirmed in Busia, are we certain that they will be able to handle it from there, being an entry point in this country? Talk to us about from where you sit, our level of preparedness. How would you analyze it?
Thank you. And maybe before I even answer that, I would like to contribute to the previous question. And I would just want to assure Kenyans that being confirmed to have COVID-19 is not a death sentence. From the statistics that we have seen, especially for the young people and those without comorbidities, without other pre-existing diseases, most probably you are not going to go even into the severe disease. About 80% of them will have a mild to moderate, meaning the one with mild might not even see the sense of coming to a health facility. It's only about 20% that probably will come to the facility, and probably half of that will go into the severe cases. And we have seen that most of the fatal cases are usually the elderly with pre-existing conditions, and of course the immunocompromised. Having said that, let me also say that one of the lessons we learned from West Africa is that the starting point for you to mitigate an outbreak is that health worker, and especially in the rural facilities, because there is this notion that corona is about the towns, the urban centers. But you never know. Somebody would come even from outside and head direct into the village, and probably you get your cases from there. So what happened in West Africa is that, like us, we are at an advantage because we were waiting for this corona. When you are the country that is the source, then it finds you when you are not well prepared. That is to say also that there is no country that can be perfectly prepared for any outbreak. But then, for them what happened, once some health workers got infected, the others literally took off. And there was nobody in the hospitals to actually manage whoever came there looking for help. Same scenario, same lessons that we can learn here in Kenya. Most of the health workers have not been trained. And when it comes to the training for such a disease with a lot of probably, I can say probably people are panicking and there is a lot of misinformation and there is fear even to some of the medics, then you don't need to even conduct this maybe a 2-hour CME that you usually conduct. You need a very intensive training so that they can understand the condition, and more importantly, they can understand how they can be able to protect themselves and have confidence that with the protective mechanisms put in place, I can actually attend to this patient and I will not infect myself. Only then will the medics be able to manage or to mitigate this outbreak. As I said, that is one of the contributing factors that actually saw Ebola cases surge in West Africa into those numbers that actually the system was not able to cope with. And also, even, leave alone the medics, even for the populace, because this is a joint venture where we all have to do our part. And I was joking today, as you said, I also went into one of the supermarkets and I couldn't find a sanitizer. And I was saying, if then you want to buy all the sanitizers in the supermarkets, you want to go and finish the masks in the chemists. By the way, they're also buying the masks.
Yes.
Then I was asking them, this is a communal thing. Even if you protect yourself, but the people surrounding you are all infected, you'll still get infected. So you actually need to share out the sanitizers you bought and you're stockpiling in your house with other people so that you can also be able to protect yourself.
Okay.
I also tried to do some interviews with the local people. And I can tell you that people think that this is a joke. I visited some of the some of the people who sell some, who have some small businesses around around the road and churches, and I was asking them, why aren't you having sanitizers? Yet you are exchanging money and you are giving our kids sweets and such. You can transmit, and the government said you need sanitizers. And they were telling me, you mean you believe these things? I don't think these things actually do exist. So what does that mean? That means there is a big gap when it comes to information, communication, and education. And there are 4 aspects to manage any outbreak. You must have the case management, where now we have Akinambagathi and KNH, where we can do our case management. You must have episurveillance, where you are having the contact tracing, the point of entry surveillance. You must have the IPC, as the lady has said, where then you have to ensure the hygiene that will protect you, and then there must be flow of information, there must be communication, and you must educate the masses so that they understand.
All right, quickly, I'd like us to offload our KTN Home channel, but if you are still interested in following this conversation, do join us on KTN News. That's it for our viewers on KTN Home. Thank you very much for joining us tonight. My name is Akisa Wandera. On KTN News, we continue with this conversation. All right, so back to it. I like that you've mentioned, the fundamentals of, ensuring that we protect ourselves. As the chairperson of the, is it Health CEC caucus, how well prepared would you say the counties are? What measures have been put in place in the counties to ensure that, we contain the situation?
I think riding on the last point Peter Wachira mentioned, that we are lucky as a country that we actually had some time to prepare. I think 3 weeks ago, we were saying it is not a question of if, it's a question of when. And therefore, between the National Ministry of Health, the national government in totality, and the county governments, we have been having preparedness at all levels. The first level of preparedness is the community, like you mentioned, that we have to continuously continue educating our masses, having the community health workers, having the communities, the national administration, the county administrations passing these messages. We have been to public barazas talking about coronavirus. What are the case definitions? What are the signs? What are the symptoms? And just pass these communications so that the communities are themselves able to identify any case that is coming in. The second level of preparedness is the preparedness of the healthcare worker, like he has mentioned, that we have disseminated information about coronavirus to all the healthcare workers across the country. We also have trained frontline healthcare workers for case management now, and we are still training more. At first we identified the 14 high-risk counties and add the training, the 14 high-risk counties. These are Nairobi, Kisumu, Uasin Gishu, the counties that have international borders to begin with and ports of entry. Then we also had training now the other counties, and they have human resource who can be able to manage the cases. We are looking at it from point of if we get a case, we have isolation centers across the counties.
Across the counties.
We also have hotlines in all the counties to ensure that if we get a case, you can link, there is a communication that someone anywhere in any county can be able to reach an hotline, both the national hotline that has a link to the county hotlines. And these are going to help.
Okay, we'll see how that goes, and a lot of questions coming in, but we're really stretched for time. Let's bring in Dr. Miriam Sidibe to give us her closing remarks as we're just about to close this conversation. From your experience and looking at the global outlook of things, what lessons can we learn from, say, China? They seem to be managing the situation now, and other European countries. And two, what can African countries do, from your experience, to just manage cross-border transmissions, or to avoid it altogether?
Well, I think China has had a. Can you hear me?
Yes, we can. Go ahead.
Oh, okay. Sorry, it's not always clear. I think there's a lot of lessons learned from South Asia and Southeast Asia, and especially China, and then I think how drastic they were with some of the measures that they took. And then I think the social distancing and really keeping people out from each other, from interacting, was a very important part of obviously stopping or halting the spread of this virus. And I think going back to the measures of hygiene, I think you cannot overstate how important hygiene is going to be in this particular crisis and in this virus. And I think there is a lot of underlying notions that actually maybe this virus is not true, or that, how can hand washing really be able to stop this virus? And I think it's really important that we have a national and even across borders and pan-African campaigns and communications that are really clarifying and bursting some of those myths that are wrong and that are going to hurt us, where we think it only happens somewhere else. It doesn't happen to us in Africa. It doesn't happen to us in Kenya. Or myths like, it's not, melanin kills it, not for black people. I think those kind of comments and thinkings are really bad. And I think this is where, at this point, where the media, where the budgets of some of these companies, actually, it's really important in terms of clarifying exactly the line of actions and how simple and yet important precautionary measures of hand washing, social distancing, and being able to really clarify and be able to know when you feel the symptoms, how to get in contact. And I think somewhere be able to let the public know that if they are feeling symptoms, that they shouldn't be scared to be able to come to the health workers. I think that's absolutely critical, because we're establishing a very different line in Africa here, and I think this is where we're going to need to work with socially.
All right, thank you very much for joining us here tonight. We appreciate your presence. Dr. Miriam Sidibe, public health expert, hand washing expert, London School of Hygiene and Tropical Medicine fellow. Thank you for joining us here on Checkpoint tonight. In studio, we had Dr. Andrew Mulwa, chairperson Health CC's Caucus, as well as the CC Health, Makueni County. Thank you. Appreciate your presence here, as well as Peterson Washira, chairperson Kenya Union of Clinical Officers, a team coordinator, African Volunteers of Health Corps, as well as team leader, Sierra Leone Medical Mission during the Ebola epidemic. Gentlemen, thank you. I believe this is a conversation we'll keep having even as we continue to track the developments. So we'll keep having you in studio to just expound and understand and educate Kenyans on what really they need to know about the precautionary measures and the information around COVID-19 altogether. Thank you for joining us.
Thank you very much.